Welcome to Swati.E channel. Today we will see the topic of pediatric is preventive pediatrics. Bright future. So preventive pediatrics is generally radiate to the health of women and the health of children. So how we will prevent our India's health of children and health of mothers. So if we see the certain aspects of preventive pediatrics, there are definition of preventive pediatrics. Here we will discuss about the classification, maternal child health, RCH, that is reproductive child health, breastfeedings, and BFHI, that is baby friendly hospital initiatives, weaning, and ICDS, that is international scheme, child development scheme, and under 5 clinics, immunization, and school health services, allied health, and international national organizations. And in all this preventive pediatrics, what is the role of nurse? So first we will see the definition. Preventive pediatrics is defined as the prevention of disease and promotion of physical, mental, social well-being of children with the aim of attaining a positive health. Classification of preventive pediatrics is divided into three, that is antenatal preventive pediatrics, postnatal preventive pediatrics, social preventive pediatrics. Antenatal preventive pediatrics, if we see, that is comes under the care of antenatal mothers, adequate nutrition, prevention of communicable diseases, preparation for delivery and breastfeedings, and mothercraft training. Postnatal pediatrics, preventive pediatrics promoted of the comes under the promotion of breastfeeding, introduction of complementary feeding in appropriate age, immunization, and prevention of accidents, growth monitoring, periodic health checkups. Social preventive pediatrics is defined as the application of principles of social medicine to pediatrics to obtain more complete understanding of the problems of children in order to prevent and treat disease and promote adequate growth. Maternal and child health refers to the promotive, preventive, curative, and rehabilitative health care for the mother and children. Components are maternal health, child health, family planning, school health, handicapped children, adolescents, healthcare in different settings. Then comes to objectives. If we see the objective, that will be reduction in the maternal, perinatal, infant and child mortality and morbidity, promotion of reproductive health, promotion of physical and psychological development of child and adolescents within the family. Reproductive child health, that are reproductive child health, our introduction program is formally launched by Government of India in October 1997 as per the recommendation of International Conference on Population Development at Cairo in 1994. Reproductive child health is defined as the people have the ability to reproduce and regulate their fertility, women able to go through the pregnancy and childbirth safely, the outcome of pregnancy is successful in. Can you say the breastfeeding is important? So RGS2 started in the year of 2005 and the objectives and the definition is same. If you see the breastfeeding could be coming from the promotion, protection, and support and the promotion of the breastfeeding. So these are the three key factors. If we define, the definition is the feeding of an infant or young children with the breast milk directly from female breast rather than a baby bottle or container. Who recommended on breastfeeding? Initiative of breastfeeding within 1 hour after birth. Exclusive breastfeeding for first 6 months. Continue breastfeeding up to first 2 years or more. Then composition of breast milk, if you see, there is a 3.8% of fat, protein is 0.9%, lactose is 7.0%, other 0.2%. That is the composition of breast milk. Here we can see the what are the benefits of the breastfeed is eyes, ears, throats and joints, skin and immune system, height, mouth and respiratory system, heart and circulatory system and kidney. There is the certain diagram is showing the what are the breastfeed and how it is promoting. The other benefits of the mother are promoting bonding, helps in involution process, lowers rates of breast and ovarian cancer, reduces the risk of cardiovascular disease. And benefits of society is the environment friendly, does not require packaging, storage, transportation and refrigeration, decreases the burden on society's healthcare system. Then good attachments on latching on, Then poor attachment is the poor latching. Then if we see the certain positions in the breastfeeding that are football position, cradle position, cross cradle position, and lying down. These are the four positions are important in breastfeeding. Then we see the definition of exclusive breastfeeding. Exclusive breastfeeding is an infant consumption of human milk with no supplementation of any type except for vitamins, minerals, and medications. So, what we will do, which international organization initiatives, BFHI, WHO, and UNICEF, these are the two which will be coming. Then BFHI is the Baby Friendly Hospital Initiatives. It is a global initiative of WHO and UNICEF, and it was launched in 1991 to initiate global assessment and accreditation to enable the mother to acquire the skills needed for breastfeeding, to assist the mother who are not breastfeeding, to implement BFHI in the curriculum for the health worker. Steps of successful breastfeeding are just 10 steps, baby friendly way, that are maintain a written breastfeeding policy to all healthcare staffs, train all healthcare staffs, inform all pregnant women about the benefits of breastfeeding, and practice roaming in the encourage unrestricted breastfeeding, and give and pacifier and artificial nipples, foster the establishment of breastfeeding support groups, help the mother to initiate breastfeeding within 1 hour of birth, show mothers how to breastfeed and how to maintain lactation, give infants no food or drink other than breast milk. What is weaning? Weaning or complementary feeding is the process of gradual progressive transfer of the baby from the breastfeeding to usual family diet. Weaning foods are given along the breastfeed. Quality of the complementary food starting to the semi-solid and solid from clean, fresh, hygienic, easy to prepare, easily digestible, and high in energy, well balanced diet. So complementary feeding at the different ages, if you see, there are for certain, that is 4 to 6 months suji porridge, we are suji, then biscuit soaked in the milk, and vegetable soup that we are making at home, and mashed potatoes. These are the complementary feedings that we can start at the different age. Then 6 to 9 months, if we see, that we can add on with the pulses, rice, dal, boiled potato, breast in milk, the mashed potatoes, egg yolk, curd, biscuit, and carrot and cucumber. Then integration child development services is launched and started in 1975 by 75 by Government of India under the Ministry of Social and Women Welfare, initiated for the welfare of children and for the development of human resources. Objectives are to improve the nutrition and health status of the children in the age group of 0 to 6 years, to lay foundation for the proper psychological, physical, and social development of the child, to reduce the mortality and morbidity, malnutrition, and the school dropout, to achieve the effective coordination of policy and implementation among various working departments, to enhance the capability of the mother to provide nutrition to child. Now we will see the beneficiaries and the benefits. With the age of children less than 3 years, supplementary nutrition and immunization is health checkup and the referral services. These are the certain beneficiaries with this by the services. And children age up to 3 to 6 years of age, supplementary nutrition, immunization, health checkup, referral services, and non-process education. Then adolescents girls will be having supplementary nutrition and health education. Pregnant supplementary pregnant mothers, for the pregnant mothers, supplementary nutrition, immunization, health checkup, and nutrition and health education. Nursing mothers should be having supplementary nutrition and health education, and health and checkup. Other women of 15 to 45 years age, nutrition and health education. The diary of services. Services are delivered by the AWW at ICDS Center. Population coverage is 1000, and AWW have 4 months training, that is Anganwadi worker. So activities of the every 20 to 25 Anganwadi worker are supervised by the Mukhi Sevikas, and supervisors supervise CTPO. So in the symbol of under 5 clinic, if you see, there are the 4 sections in a triangle. The mid one is the family planning radiating, the upper one is the care in illness, and lower left one is the growth monitoring, and right one is the preventive care. The aims and objective of this under 5 clinic is care in the illness. It is a mother felt need that 70% to 80% illnesses can be treated with the trained nurses. Diagnosis and treatment of the acute illness, chronic illnesses, and disorders of growth and development. Excellent laboratory services, referral services. Preventive care is the immunization, nutrition, surveillance, subclinical nutrition, food plus supplementation. Head checkups, and every 3 to 6 months the child health card is maintained. The child gets 2 to 6 attacks in a year. Family planning and health education. Growth monitoring on growth chart, also called as a road to health card, that is every month up to 1 year, 2 monthly up to 2 years, and 3 monthly there is up to 5 years. And the weight is plotted according to the age of group. There is a break time, but it is not applied here. So we will start with immunization. It's the process of protecting an individual from the disease through the introduction of live or killed organism in individual system. According to IAP immunization schedule, at birth, PCG OPV 0 dose, that is hepatitis B1, at the 6 weeks, OPV1, DPT1, Hep B2, and Hep1. At 10 weeks of OPV2 and DPT2 and Hep2. At 14 weeks, OPV3 and DPT3 and Hep3 and Hep3. Then that is hepatitis and Hep. That is 9 months there is a measles, and 18 months OPP 4 DPT booster and booster 1 and Hip booster and MMR, that is mumps, measles, rubella and typhoid. OPV 5 and DPT. OPV is the oral polio vaccine and DPT here is a diphtheria, pertussis, tickness and booster dose 2. Second dose of the MMR, that is measles, mumps, rubella, give at the any time 8 weeks after the first dose. 10 years, that is a TDAP, that is all 5 in 1, and HIV in the HPV in the girls that be giving. School health services, that are school health services that will be coming with the 3 sections, that is appraisal aspects and preventive aspects, curative aspects. Appraisal aspects, there are organized activities carried out to assess the physical, mental, emotional, and social status of school pupils. Components of appraisal are the history, observation, screening test, examination, laboratory investigation. Preventive aspects are the first is prevention and control of communicable disease. Second, early detection and correction of communicable disease, and early identification and education of children with special disabilities. Emergency care and first aid services. Then C comes of the curative aspect. School health program provides a curative services to school pupils. This service is provided in the school clinic provided by the general practitioners, a number of affiliated hospitals or services. School health education. It is a part of a health education that is given in the school by school health personnels. Method of school health education: formal health education, correlated and integrated health education, health and incidental health education. Healthful school environment, that is psychosocial and emotional development. This includes the school schedules, duration and timing of school days, amount and timing of homework. Healthful emotional environment through a teacher pupil relationship or pupil pupils relationship. Physical environment, that comes to safe and sanitary school facilities, classroom ventilations, lighting, furniture, play facilities, garbage disposal. Allied child is the delinquent, is the child who was committed and the offense. Juvenile means a boy who was not attended the age 16 years and a girl who has not attained the age of 18 years. Causes are others and the socials and biological, which preventive measures has improvement of the family life, schooling, social welfare. Child abuse is also known as the battered baby syndrome, and it refers to the injuries sustained by the child as result of physical, emotional, sexual abuse, factor disposable, parental, child related, environmental. So the prevention, if you see, that is prevention will be identify the abusers, inform the referral services, prepare the parents, educating the children, guidance and counseling to parents, and identify the danger signs. Street children is the large number of the children live and work on the streets at the risk of malnutrition, HIV, infections, skin diseases, and vulnerable groups, drug abuse, prostitution, etc. Prevention and rehabilitation by government or the non-government schemes, voluntary agencies, counseling, centers free education, facilitating adoption of street children and job opportunities. Child labor is the work for the children that harm them or exploit them physically, mentally, morally, or blocking access to education. Causes are poverty, unemployment, lack of education. Child Labor Act of 1986, except in the process of family based work or recognized school based activities, children permitted to work in any of the occupation concerned. What are the some solutions to child labor? Increase family income, education that helps children learn, and skills that will help them earn a living. Social services that help children and families survive crises such as disease and loss of home and shelter. Family control of fertility so that the families are not burdened by children. Child Guidance Clinic. Child Guidance Clinics will be started in Chicago in 1909. Deal with the problems of all children or adolescents for one or other reason are not fully adjusted to their environment. Objective: prevent for becoming neurotics and psychotics. Services: psychotherapy, play therapy, counseling, reconstruction of the parental attitude, change in the physical environment. Child guidance team is the psychiatrists, clinical psychologists, social workers, public health nurses, pediatricians, speech therapists, occupational therapists, and neurologists. Then international and national welfare organization. Introduction is a specialized non-political health agencies of United Nations and established on 7th April 1948 headquarters at Geneva. Every year we are celebrating World Health Day on 7th April every year. That is the objective will be a function is prevention and control of specific disease, development of comprehensive health services, family health services, environmental health services, health statistics and biomedical researches, health literature and information, cooperations with the other organizations. Introduction is about establishing in UNICEF, that is a United Nations internationally that they have established in the 1946, and United Nations General Assembly. United Nations Children Funds. Objective is rehabilitation of the children in the ravaged countries. Functions are child health, child nutrition, family and family welfare, formal and non-formal education. So, growth monitoring, oral rehydration, breastfeeding, and immunization. These are the GOBI. If you say the GOBI, that will becomes under the UNICEF. That is growth monitoring, oral rehydration, breastfeeding, and immunization. Then comes to UNDP, that will be unsaid. It is from the American people and established in 1966, helps children for the poor nation and provide education. Establishing in 1961, New Delhi function is the immunization program, ORT and family planning program, water supply and sanitation. Then UNESCO is the care. It is all about the care and established in 1945. The functions are early children literacy training for the girl, women and handicapped, established in the year 1945 and North America in 1950 in India. Objectives are until 1980s to provide food for the children till the age of 6 to 11 years. From the mid 1980s, support to ICDS health development program and income supplementation. Then comes to founded in the that it comes to Committee International Geneva and headquarters in the Geneva, largely combined for the humanitarian and services on behalf of the victims of the war. Center for the International Child, that are CICH, was created in 2004 and is a research and teaching unit. Contributed to the improvement of the health and nutrition and development of children in the poor communities. Next session we will see about the national agencies. Thank you. National agencies. So we will continue. Welcome to the Swati.E.Learning channel. So today we will start with the continuation of Preventive Pediatrics National Agencies. Indian Council for the Children Welfare, that is established in 1952, headquarters in the Chennai, and Indian Council for Child Welfare devotees to secure the Indian children by initiating services for child welfare and development, promoting enacting of the legislation and reforms to meet the needs of the children. Central Society Welfare Board is a semi-social organization started by Government of India in August 1953, initiated family and child welfare services in 1968. Activities in rural areas are teaching crafts, social education, distribution of milk, balwadis, and organization of play centers. Then we will see the objectives for this Kasturba Gandhi National Memorial Trust, that is KGNMT. It is established in 1944. Objective is the improvement of women and children. They establish hospital dispensaries, cottage industries, training campaigns in the first aid, home nursing. The integrated child development schemes are the started in 1975. Their benefits are school children and pregnant and lactating women. Packages are the supplementary nutrition, immunization, health checkup, nutrition and health education, non-formal education. Indian Red Cross Society. Indian Red Cross Society established in the 1920 and objective is to improve of the health and prevention of the diseases, mitigation of the suffering among the people. Functions are relief work, milk and medical supplies, armed forces, maternal and child welfare services, planning and blood bank and first aid. The role of nurse are primary caregivers provides preventive, curative and rehabilitative care in the all levels of health services, care of sick children, comfort feeding, bathing and safety, etc. Health educators are deliver planned and incident health teaching and informations to the parents and significant others. Create awareness about the healthy lifestyle and the practices regarding the child care. As a nurse counselor, help the parents and family members for the independent decision making in different situations, problem solving and approach. Social workers elevate the social problems related to the child health, refer the child and the family for the social support, participate in the social services. Team coordinators work along with the other health team members, maintain good interpersonal relationship, coordinate the nursing services for the child. Managers are the organize the care for the successful outcome in the pediatric care unit in hospital, clinic and community. Care advocates assist the child to the obtain best care program for possible from the particular units. Advocacy ranges from the dietary care to discussion to plan of care. If we see the researcher participates in the research project related to child health provides the basis for the changes in the nursing practice and care of children. Independent practitioners, it is the expanded role jointly practicing with the physician and independently works in rural area as nurse midwives and the primary caregivers. Ethical decision maker protect the right of the child, minimize or prevent the harm, promote the well-being and the justice. As a collaborator, interdisciplinary approach collaborates with her other specialists to provide high quality health services. Therapeutic nurse establishing of the therapeutic relationship identifies the problem area in their interaction with the family and children. Community health nurse monitor, anticipates and respond to public health problems in the population group, evaluate the health checkup factors of the population group, participate in assessing and evaluating the health services. So children are the future. Help brighten there today. Thank you for this. Next we will move towards the other topic of the pediatric. Thank you and thank you for listening us in the Swati E Learning channel.